Sorry. Yeah. So thank you for joining this session. Right. So then, why I haven't done this session bit early before the exam because you were a bit stressed with the exam. So then I don't want to make you to more stressed to do this uh, um, uh, by doing this session. So I thought like we'll do this session after the exams. So I believe this is most of the students who join the exam batch. So the junior batch students, I think they haven't got to know. So I need to please share this video. So I will share this video with you. Please share with them because they should understand about the new format, and we all have to work together to achieve this target because in a way this new format has both the component like there are some advantages, there are some disadvantages, so you may have to do different kind of preparations to overcome this, so like pass this exam. So first of all, like I think you had a couple of sessions by other teachers, so you might know the basic idea. You might go went through this PDF which has been shared by the SLMC. So you might know some idea about this ERPM. So existing ERPM, of course, you all know we have part A, part B, part B, part C, and part D.
Present this video. I will share this video among yourself. Now, please share this video with your juniors because that is very important. You will have to understand because this is not going to be easy as you think. Okay, so you have to understand how the exams it's going to be and how they improve their standard to recruit you into the SLMT. Okay. So I think majority of the students who joined to the class today, the meeting today is exam batch students. So I would like to tell you, please share this video with your friends and your juniors to make them aware like how to do this exam. So as I mentioned earlier, all right, okay, you might know about this format already. You might attended a couple of meeting with other teachers, so you might know about the new format, but still I just want to tell you the format because I don't want to tell each and everything about the format because you all are aware from the the PDF which has been shared by the uh, SLMZ, but I just want to highlight how it is going to change your way of preparation and how it is going to help in a way you can positively take this exam, and what are the modifications you need to do it in the preparation in terms of OSCE. Okay, because the OSCE objective structured examination, basically the OSCE is quite new for you, I believe. So you all have to understand what is this OSCE and how they are going to assess you, how have you have to prepare, how we have to prepare yourself for the exams. All right. So what are the possibility? But still, we are lagging in some information about the exams because we don't know how they are going to do this OSCE and what is the guideline. But still, the way they present and what are the things they are going to assess with your exams and all. And as they mentioned, we wanted to upgrade our exams into the international standard. So, like when we see that one, so we can understand how they are going to conduct the exam. Okay. So, as you all know, the previous format, which is currently you're doing the exam, which is has part A, part B, part C, and part D. Okay. So, your part A basically major subjects, and part B your Viva, part C is emergency, and part D your minor subjects like community and forensic. All right. So, basically now they have changed the system in little bit different as part 1 and part 2. Okay, so the part 1 is basically theory, and part 2 basically the OSCE. So before we move to this ERPM exam, so we need to have some idea about the existing international licensing exam, how they are conducting. and existing memory like membership exams, how they are conducting. Okay, so for example, if I talk about lab, so how they are conducting the lab. So the lab part one and part two. Okay, so in part one they have written exams. Part two they have OSCEs. So the SLMC is mirroring the same system as lab now. Okay. So you have the part one, but in terms of part one and part two, so in PLAB, so the part one is a pool of collection with different subjects. Even they have some basic sciences. But luckily, in ERPM, still they have the part one. They have still they have paper one, paper two, paper three. Okay, so still they have some kind of modification. So they don't want to completely leave from the tradition, and same time they don't want to away from the international standard as well. So they are just mixing up both. Okay, so they still combine two subjects together like medical track. Like previously, we say it's medical track, like medicine and pediatric and surgery and general ops, right? So now even for the papers, part one and part one, paper one, paper two, they combine both subjects. So, but yeah, in a way, but if you see the part one, right? So part one, it's a MCQ. So here there are a few advantages having this rather than having a common paper. Like say, sometimes they can you can have like 300 questions, one paper, combination of all questions. So that is also one possibility. Maybe in 5 years time or 3 years time, your format might change, right? So earlier we were having separate papers. Now they combine few subjects together and they are doing the exam. So nothing change in the MCQs, nothing change in the XBA. So it's going to be same, but they combine. Okay. But nowadays, if you look at these like membership exams, now even the PLAB, now the MCQs is not in use, right? They are not using MCQs. Now they're having SBA and EMQ. So there is a new format. Majority of the UK universities licensing exam they are using EMQ, extended much questions. Okay, so hopefully the next change will be introduction of EMQ to the ERPM. So we all have to update. So we can't be like even like now you can see like how we are adapting our way of teaching for ERPM students. Like so we started with tuition centers. Like there are tuition center in Kurulapana, in Vallavatte, Bambalapudi, right? So you all have to behave like a A-level tuition student. But now we improve, right? So now you all have different platforms, different facilities and features and all. Like you have plenty of opportunity to study, right? So so when you come for a summer holiday, you can't enjoy your summer holiday. You have to attend the classes to uh, learn something. Then once you come back from the graduation, so you have to stay in Colombo. It's be expensive. You have to find the accommodation, attend to the classes. Morning 8 o'clock class start, at evening 9 o'clock class will finish. So like 12 hours, you can't concentrate. Very hot. You have to be in the queue a bit early to find the front page, like the front tables. So there were lots of things. Now, no, it at your convenient time, anytime. So you want to sleep at 2 p.m.? Yes, you can. You want to study at 12 a.m.? Yes, you can. So the system's changing. So the exams patterns also changing, right? So now, so same thing. Now they haven't changed the questions. They haven't changed the question pattern. So that is bit of relieving because suddenly changing everything might be difficult for you. So they haven't changed anything in the question pattern. So its questions are going to be same as an MCQ as an SBA. So the first advantage is it's going to be same pool, same concept, same way of presentation, same way, same structured of questions. right? So same structure. So you don't need to be worry or you don't need to panic to attend the new format of exam in terms of theory because it's going to be same. But they have combined two subjects. So we will come to that format a little bit later. So that is the first thing they made it. Second one, we had the traditional long cases, short cases, the patient-based history taking and all. So that is what I prepared when I was medical student. That is how I passed the exam. That is how I did my part two exams and all. That is how I became consultant. But now they changed into OSCE. But this introduction of OSCE has been introduced to my part one either. So when I was doing part one for my postgraduate exam in 2016, I had OSCE. Then part two in 2019, I had OSCE. So the OSCE has been introduced in the Sri Lankan curriculum a bit early, but now they have introduced to ERPM. All right. So it's very easy if you understand the structure, right? So because this OSCE system has been introduced in majority of this licensing exam as well as the membership exam. So maybe it could be a MRCP, it could be MRCP-H, it could be a FRCS or MRCS, whatever, MRCOG, whatever. You have the OSCE. Flap, you have the OSCE. Okay. So having the OSCE, what is the advantage? Why we are having OSCE? Like why they have in terms of theory, why they have removed the MCQs? Because that is quite confusing you. And as always, I am mentioning in the classes, the MCQs are directly assessing your knowledge. That is our traditional way of teaching and studying. Like you remember something because in Sri Lankan education system, if you can memorize something, if you are a hard worker, still you can become a doctor. Still you can become an engineer because you just memorize, you just do hard work, somehow you get 3A and become a doctor. But when you become a doctor, when you practice into the patient, more than your memorizing capacity, more than your hard work, there are other attitudes and other soft skills needed to execute your works in proper way. Like how to apply your knowledge in appropriate time, how to gather information, how to identify the problem. So there are so many things. So ideally, the exam which is conducting for assess the suitability to be a doctor should be in that way. We have to assess how suitable you to become a doctor. All right. So the MCQs are directly the following are the risk factors for preterm labor. So you have to remember if you know, yes, you will pass. If not, you will fail. So it's directly assessing your memorizing capacity rather than thinking capacity. It's not assessing your thinking capacity. So your memorizing capacity should assess in an indirect way rather than the direct way. So the MCQs are not honestly assessing your thinking capacity. It is just if you know the stuff, yes. So that's the reason in majority, internationally, majority of the exams, the MCQs are now out. But still, in ERPM, we have MCQ. So it might be out maybe in 2, 3 years. Definitely. I'm telling you, mark my word. The students who are joining to this session from second year, third year, mark my word, the MCQ will not be there. But now you should know that is the relieving for you guys because till the exam questions, the pattern it's going to be same. The pool is going to be same. They are not going to create a new set of MCQ. They are not going to create a new set of SBA. Almost same. The concept is going to be same, but the structure, the exam structure has been reorganized. That's it. Nothing else. Okay. But They are trying to introduce certain things to you to assess your knowledge. Say, for example, if I talk about MRCOG, part one, part two, part three, okay? So, part one, they assess basic science, anatomy, physiology, pathology, biophysics, and all. Part two, they assess the obs and gynae knowledge, like your guidelines, labor, and stuff. Part three, they're doing OSCEs. Okay? OSCEs, you are not going to see the real patients. They are actors. Okay? They are actors. Even the same concept has been done in my part two in Sri Lanka. They are actors. They will be there. They act on you. They will act as a patient. You are going to take the history, do the relevant stuff with that actress, and do exams. That is how it is. That is how it works. Okay? So they have certain principles to assess you. So why I am telling all these things, I want to correlate those things with the new format. So because it is no point of just making a presentation from what the SLMC shared with you and just telling you, yeah, this is the format. Okay, you have to understand how they are adapting the system to the international standard. Because if you, when you see their covering letter, they have clearly mentioned. So we need to upgrade our exams into the international standard. So how they are adapting the exam into the international standard is the way. Because I'm always telling you, when you prepare the exam, you should understand the exam structure. If you understand, then it's easy. Okay. So when you see the patient, they are assessing you in five component. That is called five domain. They are assessing you in five domain. So basically, the same concept is applied in PLAP as well. Okay. So what are those five components? One is information gathering. Okay, information gathering. So what you understand by information gathering? So you are going to take some clinical information regarding that patient. Do you understand what I'm telling? So you are gathering some information regarding the patient. So information gathering could be in a different ways. What are the ways? One could be a history taking. You can ask few questions. Say for example, so I would like to differentiate or like tell what is the real factor or what is the real thing when you are doing in the clinical practice and what are you doing in the exam. So far we had these long cases. Even I will say about the obgyn gynae, you get the heavy menstrual bleeding. So in terms of heavy menstrual bleeding, you are allowed to take the history for like 7 to 8 minutes. Even though they said 10 minutes, like 7 to 8 minutes. So for like 7 to 8 minutes, you are going to talk so many things with the patient. Their name, age, distance to hospital, lot of information. But when you come to the clinical practice, are you going to do the same? No, you're not going to do the same. You will ask few questions, but those few questions are very relevant to that patients to come to a conclusion to diagnosis. So we are testing something else and we are practicing something else. That is the difference between the assessment and the clinical practice which we had it earlier. But now they are going to assess you how you are going to do it in the day-to-day clinical practice. So, like when you see a patient, when you are clerking a patient as a house officer, how you are going to get the information? What are the information you are going to ask from this patient? So you are not going to ask each and every questions what you have done in previous. So you are going to get a few important relevant information which will help you to come to the diagnosis. Okay. So the information gathering could be a history taking. You may have to do a very important examinations, maybe a relevant general, checking the pale on certain things and the abdominal palpation, something like that. Then, of course, your investigations. Okay. Sometime in the OSCE, they might provide the investigation results. Sometime, if not, they might ask what are the investigation you may have to do. Because even in the investigations, you are going to gather some information about that patient to come to a conclusion. Do you understand? So information gathering, these are the things will be included. So you go through the patient, get some information, gather information from the previous notes or maybe a clinic books, examinations, and the investigations. Whatever the investigation already has performed, you need to go through it, and you can plan out any other investigation you need to do to get further information, right? So the basic thing is information gathering. So keep it in your mind, information gathering. So that we just forget about the history taking. Now I don't think in new OSCE you will have history taking. History taking is going to be a part of your information gathering. Like I will explain you this, then I will come back to the new format, then you will understand how they are changing the system. Okay. So information gathering is a part, like basically the history taking is a part of information gathering. So information gathering is going to be uh, history taking, examination, review of the previous notes, or maybe some review of previous investigations. Right? So information gathering. Second one, so I'm not telling about the new format, I'm telling about the existing international exams format. Okay? It's information gathering. Second one, communication patient. Okay? So they are having certain component of marks.
Okay, I will explain. So there are five components they are assessing. One is information gathering. Information gathering means you take the focus history taking on the patient. Okay. So because in clinical practice, when you see the patient, you are seeing the patient and you just ask few questions to find out the real problem to come to a conclusion, right? So history taking or the focus history taking. So the traditional history taking is going to be it is not going to be in practice, because in traditional history taking, like you are asking so many things for like 10 minutes. Now they have given only 10 minutes for you to have this structured exam or skill. All right. So here the information gathering, which include history taking, and you have to gather some information from their previous records. So for example, their clinic books and all. Do you understand what I'm telling? So you need to gather some information from their clinical, and also they might provide some investigations. So from the investigation, you gather some information. So you gather information going from the history taking, examination, previous notes, as well as the investigation. So your traditional history taking, it's going to be a part of information gathering, right? Part of information gathering. It is going to be a part of information gathering. Do you understand what I'm telling? Right? It is going to be a part of information gathering. So that is first, history taking. So information gathering. Second one, communication with patient. So how you are going to communicate with the patient, right? What are the component? Like what are the important things? Like, so what is your sympathy? What is your empathy? How you are going to talk to a patient? How you are understanding the patient's real need? Do you understand? So they are going to check your patient communication. Third one, communication with the colleagues and relatives. So which means, like, as a house officer, as a general practitioner, you are not supposed to manage the patient. You might do the initial assessment, you might do the initial part of the management. Once you done that initial part, you should be able to escalate the stuff to the relevant people. It could be your SHO, it could be your registrar, it could be your senior registrar, it could be your consultant, or it could be to the other relevant specialties like physician, surgeon, pediatrician, endocrinologist, cardiologist, whoever. Do you understand what I'm telling? So you should be able to escalate to your colleague. So the domain is going to be communication with your colleagues. Then, sorry, patient safety. What do you understand by patient safety? Certain things you need to do for the safety of the patient. Say, for example, this patient safety is a wide area and which carry a huge importance in the exams. If you do mistakes on patient safety, you will be failed, right? So there are, if you divide this patient safety into broadly two, one, the patient safety in terms of treatment and patient safety in terms of medical legal. Okay, so patient safety in terms of treatment, in the sense, like, say, for example, if a patient 6-week pregnant lady came with abdominal pain. So if you forget to do a urine pregnancy test, that is danger in patient safety point. You are missing a cardinal thing which can kill the patient. Do you understand what I'm telling? Right? So in terms of medically, you are missing the stuff which can harm to the patient. Right? So likewise, there are small things in the patient safety points which can affect the patient in terms of management. So medical point of view, what are the patient safety things? Second one, medico-legal safetiness, which means if a lady came with abdominal pain, unmarried girl, 16 years. So here, you should know what is the safeguarding. What are the medico-legal action you need to do for it? How you are going to tackle this patient safety in terms of social background. Do you understand what I'm telling? How to escalate to the relevant authority to safeguard her. So that is the patient safety. And fifth one is applied clinical knowledge, which means with your information gathering, which your assessment, how you are going to apply your clinical knowledge to manage this patient. Because I told you, as a house officer, as a general practitioner, you are going to do the initial management. You are going to do the initial assessment. So they are going to assess you the initial part of the management rather than the sophisticated management. Do you understand what I'm telling? So there are 5 domains. This is a common structure in the international exams. So information gathering, communication with patient, communication with colleagues and relatives, patient safety, and application of your applied clinical knowledge. Those are the 5 domains, right? So now they are going to assess or adapt the system to the ERPM as well. Now, yeah, this is the new format of exam. I'll show you. So basically, you can see the effective date is 1st of January for the medical professionals from overseas. If they want to get the registration, so what is the structure? Clinical skills, application of knowledge in clinical setup. Do you understand? So here, as a clinical practitioner, at the initial stage of management, how you are going to apply your knowledge. They are not going to ask your knowledge. They are going to assess your application of your knowledge to the clinical practice. Do you understand? This is the change. This is the major change. You might not understand the importance of this. This is the major change. Application of knowledge in clinical practice, because last time when you prepare, so current setup, when you are preparing the exam, always you are thinking, okay, when we are doing the MCA PhD, when we are doing the doctor's venosus, yes, of course you need to know, but here when you answer this question here, you need to tell how you are going to apply this doctor's venosus in Sri Lankan practice. Clinical assessment, see, the components are clinical assessment. That is your information gathering. They haven't mentioned history taking. They haven't mentioned examinations. They haven't mentioned investigation. Right? So you have to do the assessment. Your assessment, which include history, examination, investigation, and review of their previous notes. Do you understand? So you might given some information. So instruction notes will be there. So you can see this information card and gather information, take relevant history, do the relevant examination if you want, if they ask, review the investigation which has been provided, and order for relevant investigation. That is your clinical assessment. Care planning. Right. What is care planning? It's a new wording, right? What is care planning? What is care planning? How you are going to, because this is nowadays the management is going to be MDT, right? Each and everyone, it's going to be a multidisciplinary. You are not supposed to manage this patient. You are not supposed to manage this patient. So your care plan, which include, so involvement of your colleagues. Your colleague could be your senior, could be a subspecialty person, right? So there are few people. So how you are going to plan out? How, when are you going to invite your people? How you are going to make your management on the base of patient safety, right? And management is based on your application of knowledge. So the clinical skill which is applicable for your clinical assessment, your care planning, as well as your application of your clinical knowledge to the management. And now this is the new thing, medical legal responsibility, which is the patient safety. Do you understand what I'm telling? So now you can understand how they are adapting the system relevant to the, the international standard. Okay, it is totally a different, which you have prepared earlier. It's different now. It's different, especially for the OSCE. It's going to be different. Don't worry. I'm going to prepare everything about the obs and gynae, how to do these things, because it is a common one. Because like I'm doing MRCOG exam preparation, so I know how to do this one. It's not a big thing for me, but for you all, yes, it's big. And the people who are studying with me, majority of the way of preparation, except this history taking, it's based on this. So I'm always telling about your communication, referrals, isn't it? Patient safety. We always talk about it, isn't it? But now it is come to the action. I'm always telling you, even in the MCQs, you have to know the basic science, pathophysiology. That is what the application. It is not the matter of memorizing. So I'm really sorry, the students, now you are going to affect, because very simple, because like majority of the time you guys are not attending to the fast track session. You guys are not attending to the case discussion. You guys are not attending to any of the assessment. You think you can just read the books, you can just read the tudes which has been given by the teachers. You just wanted to be as a A-level student. I'm really sorry, those students will fail the exam. I'm telling you, you will fail the exam until you start to practice. because their exam structure has been changed. Now you have to perform, right? Okay, so you have to perform. So you need to have that ability. You have to develop it. There is no question on it. Okay, so scope general practitioners level in Sri Lanka. Very simple. This is what I said, told you. So once you become a general practitioner, how you are going to practice? Tasks include diagnosis. See, diagnosis. You should be able to diagnose. Initial treatment. See what I told. This is what they are assessing. Initial treatment. So they are going to assess you whether you are suitable to do the initial treatment. Not for the sophisticated thing. Referrals. How you are going to communicate with your colleagues? When are you going to refer? Referral include not only your other specialty, also to your senior. How? When you are going to escalate? Aftercare. What is your post-operative care or post-discharge care? So how you are going to, like, it's a continuity of the care, right? Communication. How? See, do you understand? Now you are in the position. Communication. Critical thinking. Right? So how you are going to apply your knowledge, critical thinking and teamwork. Finally, support for the Sri Lankan judicial system in medico-legal matter. Right? Critical thinking, teamwork, support for the Sri Lankan judicial system in medico-legal matter. Do you understand? So now you can understand how they made a small alteration in the existing international assessment. Okay, very simple. They made a small adjustment, but the domains are same. Information gathering, communication with patient, communication with your colleague. So communication with patient, yeah, directly they are assessing you. Communication with colleague, directly they are assessing you, the referrals. Patient care, patient safety, yeah, directly they are assessing you. That is in terms of medical, in terms of medico-legal. And finally, your application of your knowledge at the initial statement, initial part, your initial assessment, initial treatment. Do you understand? This is the OSCE. So now we come to the point, like, what are the advantage of having these OSCE exams? What are the advantage of having, disadvantage of having OSCE or exams? Then, like, which one is better? Okay. So what do you think? Part one, theory component. First of all, we'll discuss about the part one. Then we'll discuss about the part two. What do you think? Part one, the new format. Which one is better? Existing format or new format? Tashmi, what do you think? Which one is better? New format or existing format?
New format.
Why? Anyone? So here is a critical thinking, right? You get a new question. This is what they are going to assess you. Think differently rather than just memorizing what I gave the notes. Anyone? Which one is better? New format or existing format? You have attended certain classes. The new format, Combat Forensic and Psychiatry, has SBA, which has helped passing those subjects. Okay. So the SBAs are quite easy to mark it and you don't have negative marks. So now Combat Psychiatry and Forensic has SBA. So it is, which is easy to pass. Yes, I accept. Yeah, that is one point. Anything else? Which one is better? New format? Any other comments?
Previous format, sir.
Previous format. May I know the reason?
Yeah, before we finish the medical track, we can just do the Viva exam for medical track. If we
Exactly.
finish the surgical, so we can do for that.
Exactly. Because you had the options, you can do one You don't need to depend on the other subject. So even if you fail one subject, you can do another track. So you can do partially. So sometimes you might feel difficult to do all the subject at once. So you have the options. You can move forward with one track and you can do the next track in next time. Yeah. Agree. I agree. Asala, any other thing? Okay. I agree. Totally agree. So the old format or existing format, you can do uh, one track first and second track second. So you can choose and do, you can plan out your exams. But the new format, which is not allowing you to do that kind of things. You have to complete your part one to sit part two. You have to complete to your part one to sit part two. That is the main problem. So you have to pass all the part one, all subjects, all 7 subjects. Then only you can do the part two. Am I right? Isn't it? So that is the disadvantage. But there is an advantage as well. So I notice an advantage. What is the advantage? Anyone? In new format? There is an advantage. I wouldn't say always it's wrong. Maybe advantage, some disadvantage. What is the advantage?
Hello, sir.
Yeah,
Maybe it could be because, like, if one student is lower or like less smart in one subject, he can compensate with the other
exactly.
subject.
Exactly. Very good. So basically, which is giving a chance you to compensate. Because I know there are so many students are failing the exam by 1 or 2 marks. They got 44, 43, 42, and they fail. So many students are failing by 1 or 2 marks. But here, as they combine both subjects, sometimes if you get 44 in surgery and 52 in 55 in 56 in genenops, still you can pass the exam because the genenops marks will compensate your surgery marks. Because I know one student got surgery 658, genenops 44 last time. So 44 and 58. Like old format pass marks is 45, right? So he failed only 1 marks. But he got almost 13 marks higher than like extra in surgery. But now one subject is going to help you the other subject. But that doesn't mean you can study one subject and pass, because now the second advantage comes, your pass marks is 50, not 45. Your pass marks is 50 now. So getting more than 60 marks in one subject is quite difficult. Agree that? Say if you get obs-gynae 60 marks, still you need to get 40 marks in surgery. So without studying, it's not easy to get 40 marks in surgery. Or without studying, it's not easy to get 40 marks in obs-gynae. Do you understand what I'm telling? So it's quite difficult to compensate too much. You can't get 50 out of 50 in surgery or obs-gynae. Because out of 100 questions, you need to get 50. So if you ignore obs-gynae, then you have to get all 50 marks from the surgery. Or if you ignore surgery, you have to get all 50 marks from obs-gynae. It is not possible. So you have to study both, but there is a small possibility and chance one subject will compensate another subject when you are close to the pass marks. So surgery you got 55, genenops you got 45, still you pass the exam. Because the surgery marks will compensate to genenops. So it can be in the other way around. It's not a problem. Do you understand what I'm telling? Right? So compensation is the advantage in part one. Now, but disadvantages are, as you mentioned, like you can't do one track second, the pass marks has been increased to 50. Earlier it was 45. So it's quite risky, isn't it? Now they have increased the pass marks. Now it's 50. And third one, you have to pass all the theory exams to do your part 2, your skis. And fourth one, if you get less than 25 any of this paper, where is that? Yes. If you get less than 25 any of this paper, you need to repeat all the subject. Those are the disadvantages. Why I am highlighting this disadvantage? Because you have to improve on all those things. Right? So these are the things, like, because here the new criteria, you need to get more than 50% to pass the exam. If it is less than 25 of any paper, you need to repeat all the subjects. In between 25 to 50, you can repeat that particular subject. Okay, so that's a major problem here. So now you all understand, very simple. It is a nice one, but you have to work hard. It is not easy. I'm telling you, especially for the juniors, the preparation at last 2 months, it's not going to work. After getting your degree approval, you can study. No, it's not going to work, because they have made so many rules and regulation on that. Because once you get this degree approval, you can't skip the exam except a valid medical or educational reason. If you get the degree approval, you need to do the exams. You can't skip any exams. You keep doing the exams. Or you have to submit a valid medical reason. Or if you are doing any educational activities, like maybe a postgraduate, MSc, PhD, you can provide the evidence, but maximum 3 years. Otherwise, you are not eligible to do exams. So whenever you sit the exam, you are losing one attempt. When you lose one attempt, you will be ranked behind, because first they will rank the first attempt people. Then they will rank the second attempt. Then they will rank the third attempt. Then they will rank the fourth attempt. So if you are doing fourth attempt, even if you get 90 marks, you will be ranked after the first and second and third attempt person. Even that first attempt person get 50, you got 90, you will be ranked after him. So the attempt is matter. Do you understand? Don't think I can do next time. No, attempt is matter, because your rank is very important for you to choose your hospital, choose your specialty, choose your accommodation, choose your post intern appointment, everything. Until you do postgraduate, your rank is very important. Even if you do postgraduate, even you become a consultant, when there is an appointment to a particular hospital, say if I'm applying to Castle Street, Colombo, 2 candidates are applying, myself and another batchmate who is same batch from me, then they will see my final year rank. What is the final year rank? Who is like higher rank, he will get the opportunity even after becoming a consultant. So your rank is the matter. Please don't ignore this rank. So there is no time. So once you get the approval, you need to do the exam. You have to pass the exam in one go. Otherwise, your rank will be like it's a bit behind. Do you understand what I'm telling? Okay. So part A, part 1, part 2. So I'm highlighting the negative parts. Then only you understand the exam. Then only you can prepare it. So better to prepare bit early. So while you are in medical faculty, while you are in the universities, start preparing, do the papers. When you get the approval, you should be able to do the exam. You can't start theory after coming or after starting the theory. Do you understand? Because whatever the course we conduct for part A and part D, it's going to be same. Because theory is going to be same, exam is going to be same, questions are going to be same. No change at all in new format. Only the assessment way has been changed. That is mainly, except that compensation. Rest of the things are not favoring to the students. Do you understand? I told you. Except that compensation by one subject, everything is not favoring to the students. It is not. So they made it hard. That is the real fact. They made it 50%. They made it like you have to complete all the subjects. They stopped skipping the exam. They stopped doing one track. Everything they stopped it. Right? So they made this exam bit hard. That is the real fact. You have to understand. Right? So playing, skipping. So because I know several people skip the obs and gynae and do other subjects, and they are thinking this is the most important subject. I have to pass. No, now every subject has equal value. Do you understand? Because you can't skip one subject now. You have to pass all the subject, do your part two. Okay? So you can't play with your exam. So very, very careful. Make it serious. Otherwise, you are going to lose your money. You are going to lose your life. You are going to lose your time. Right. So in part two, they are going to do as an OSCE, Objective Structured Clinical Examination. So I would like to, okay, I'll ask few questions. So existing part B and new OSCE. What are the difference? So which one is better? What do you think? Now you have some idea about the OSCE because I told you. What are the advantage? Which one is better? What do you think? Anyone?
ASCII
Older one is better
Older one is better. Okay, why?
because like you can clear one subject by one subject.
Okay, again we are coming to that point. Yes, agree. You can clear one subject, then next time another subject. Finally, you have to clear everything. Yes. Anything? Yeah. So older one is better. I agree because you can clear one by one. Yes. Older or newer? Somebody said OSCE.
Yes, sir. ASCII is better because previous one we have for one station 20 minutes like. So
Mm-hmm.
sometime that case will go deep to ask more question. But nowadays it's a 10-minute station. So if we know the proper answer for the station, we can just finish it off and go to next station.
Exactly. Exactly. I agree. So they are assessing only one station in previous. So then if you are not, so for by luck, if you don't know about the PIH management, that's it. You fail the exam. Because it's 20 minutes, they are assessing one. You are not sure which one you are going to get it. Yeah. So OSCE, no, it is okay because even if you miss one station, you can cover with the next station. Yeah, so previous station I agree, you can do one by one. Yes, but here you can't. So advantage is like you can do one by one. Disadvantage is if you don't know, then you will fail. The OSCE, even you don't know one station, you can do the other station. Okay, any other advantage? Disadvantage in previous station? So the previous station, you all know, like you had language barrier, you had different stations, you have different examiners, and questions are subjectives. Like different examiners will ask different questions, depend on their mood, depend on the way your discussion going on, isn't it? Sometimes same case, some students might get easy questions, some students might get tough questions. Am I right? There is a possibility for this favorism. Yeah. All right. Tasmi is coming to Jaffna station tomorrow. Machan, mage yalo akena kenawa. Ari. That's okay. I'll look into that. Yeah, possible, right? Yeah, possible. And it's very objective. Sorry, subjective. Very subjective. So it's not a standard. But here, OSCE, you are going to have a structured question. So hopefully they haven't released the guideline how they are going to do it, but the OSCE standard in international, so they can't change the OSCE, no, that is the standard exam way of conducting the exams. So OSCE, oral, so objective, structured, clinical examination. This is a structured clinical examination. Structured, which means already questions are structured. So if you are going a particular day, each and every students are going to get the same question, same answers. So there will be a guideline or like marking scheme. You are supposed to tell those marking answers to gain the marks. So it's not depend on your examiner. It's depend on you. Do you understand what I'm telling? So the favorism is out. So individual variation is out now. So like because they have clearly mentioned 20 stations, 20 candidate will be assessed at the time. Then second round, another 20 candidate will be assessed. Third round, another candidate will be assessed. So like that, they might have 3 or 4 stations. So parallelly, they can have kind of 100 students. Like if they have 5 stations, 100 students will rotate. Second round, another 100. Third round, another 100. Per day, 300 students will be assessed. That is how they conduct the exam. Even MRCOG, they do 2 days, 3 days. So the first day candidate will get set of questions. Second day candidate will get another set of questions. So there will be a difference between 2 days, but the particular day, every candidate will be assessed with the same question. So if you are not smart enough, you will fail. So ultimately, the pass rate will reduce if you are not competent enough. Do you understand? Because there are a set of answers. You have to answer to get that tick box. Otherwise, you will fail the exam. So if there is a point for the communication with colleague, referral, if you are not referring, you will not get the answer. Sorry, if you are not dealing with that medico-legal stuff, you are not going to get that answer for that. Do you understand what I'm telling? So you should know what are the, so here, what I am going to teach you is each cases, what are the points you should know in terms of information gathering, in terms of application of knowledge, in terms of referrals, in terms of patient safety, in terms of medical legal. So be careful, especially in obs and gynae, you should know about this medical legal stuff. Do you understand? So they have emphasized several places about this medical legal. Medical legal doesn't mean you should know the forensic medicine. That is different. Forensic medicine is a subject. But medical legal is important for each and every subject, especially in gynecology. Like when the patient comes, like 16-year-old lady came for the delivery. Here, provision of contraception to that patient has medical legal component. To whom you are going to inform? Are you going to invite the social workers? Do you understand? So it is not easy. It is quite difficult. But in the previous session, you can smile and tell something because you know the format, like this patient, LMB, EDD, POA, first trimester, second trimester, third trimester, fetal movement, At least you tell that routine format and somehow you can spend that 20 minutes. Am I right? That is what you did. Somehow you memorize the format and you just ask that format and you spend 20 minutes. Somehow you pass the exam. But now, no, it's not possible. Here, you need to know different components. You need to know certain things in the history. You need to know certain things in your management. You need to know certain things in terms of communications, referrals, aftercare, medico-legal. See, several components are in place and it is structured, which means the questions are there, answers are there. You need to fill that tick box. If not, you will fail the exam. They have clearly mentioned. Of course, they haven't give the what do you call this guideline, but they have clearly mentioned what are the things we are going to assess, right? See, tasks include diagnosis, initial treatment, referral, aftercare, communication, critical thinking, and teamwork. What else they want to give? And the most important part, it's going to be a structured exam, which means they have the pre-existing question man answers. So you have to touch each and every component. Otherwise, you will not get marks on that component. So here, as a teacher, we have to work hard to help you to prepare to this format. Do you understand? Because this is new to you. We need to make you to understand how it's going to work, how to answer, how to handle, how to prepare. Do you think you can do it at last moment? No, never. You need more practice. So if it is, sometime you can get a stations for the breaking bad news. Simply. Ectopic pregnancy, breaking bad news. Miscarriage, breaking bad news. Still, even though it's a breaking bad news, you will be assessed all these components. Your information gathering. So even if you are going to tell this is the ectopic pregnancy, you need to ask the history. You need to look for the patient safetiness, whether patient is stable or unstable, whether patient is severe hypovolemic shock. That is the patient safety. You need to communicate with the other colleagues like anesthetist, blood bank people to get the blood done, to get moved to the theater. You have to inform to the theater team. That is your communication with the other team. Referrals. Do you understand what I'm telling? So that is the problem in this OSCE. Now, as it is a structured one, you can't like just do something, just tell something for 20 minutes or 10 minutes and come out. Yes, you can talk for 10 minutes, but if you don't have the points, you will not pass the exam. Here, the random studying, random teaching is not going to work. You have to have focus history taking, focus answering, focus. Do you understand? Focus. So it's not going to be easy, I'm telling you. Right? So that is the first thing. Second thing, the disadvantage. I'll tell the disadvantages. One is like the advantages, of course, like your language, the examiner's bias, like time. Because you know, sometimes some students getting scolded by the examiner without any reason. It's depend on the examiner's mood, mind. Sometimes some examiners might have their own practice, and when you are telling the guideline, they don't get into, then they will get angry and scold you. It happened. You can ask your seniors. Now those kind of things has been eliminated because the SLMC clearly mentioned they are going to have a pool of examiners. The examiners has to apply to be as an examiner. Then they will choose the examiners from the pool, and they don't know when are they going to be in the exams. So they will call some examiners, do the exams in a common station. I think it's going to be in a common station, probably in Colombo. Because it's OSCE. Even they will invite the actress rather than the patients. So you don't have, you will not have, probably you will not have the language barrier. You will not have the examiner's bias. You will not have the individual bias, because it's going to be a same question. It's going to be a structured question. So if you are prepared, if you are smart enough, if you are knowledgeable, you will pass. That's it. So those are the advantage. Disadvantage, whatever you did now, no. Because whatever the obstetric case, you're asking the same format now. And you somehow you manage. No, that's not going to work now. Now you have to concentrate each and every component in each case. That is the first disadvantage. Second disadvantage, if you fail that OSCE, you have to study all the subject. You fail 3 stations in obs-gynae and 2 stations in pediatric and 1 station in 1 or 2 station in psychiatry. But rest of the station you did well, but overall you fail. Next time you have to study everything. Do you understand? So that's the reason I told you that skipping the subject is not going to work for you. You can't skip. You can't skip, because one subject will ruin your life. Whatever the subject, you can't skip. It will ruin your life. Right? So that is the second part. So definitely you need to study, and if you fail, you have to do everything together. Third one, this is the very important point. I don't know whether you thought about it, but that is a fact. I'm not talking about the other subject, because I'm not like genius on the other subject. I'm genius in my subject. I believe I can. Okay. Say, so far, you have certain cases in obstetrics. Maximum 10, 12. Certain cases in gynecology. Maximum 10, 12. Am I right? PIH, GDM, IUGR, past section, anemia, RH negative, right? Uncomplicated pregnancy, maybe some other medical conditions, epilepsy or something. So few things only. So if you prepare those 12 cases, it's more than enough. You can pass the exam. Yes or no? But now, after introduction of this OSCE, it doesn't mean all the time will involve with the patient. Right? It is not, it's an objective structured clinical examination. So it could be with your papers or instructions, right? So it is not always with patients. So there are chance you can get hot topic as OSCE. Say for example, hyperemesis, ectopic. You never get ectopic in OSCEs. Yes, you can. Recurrent miscarriage. Yes, you can. Urinary incontinence. Yes, you can. Deep vein thrombosis following cesarean section. You can. So now your area for this part 2, it's going to expand. I think which is applicable for other subjects as well. Because in medicine, you might have long cases, certain number of long cases, right? I believe. Am I right? Certain number of long cases. But now, few things can be included in your scheme. Acute MI, was it a long case? I'm just asking. That's me. Acute MI? I don't think, because acute conditions won't come as a long case, I believe. But now they can. They can give a scenario, put a CTG, sorry, I'm always telling, ECG, okay? They might provide an ECG. Even one actress might be there. There could be some set of questions. So then you need to read the question, get the relevant information, review the ECG, comment about the ECG, do the initial management, and do the relevant referral. Refer to the cardiologist. Further evaluation. They might ask, okay, what are the further evaluation? Then you may have to talk about the angiogram, something, blah, blah things. I don't know. Yeah. Do you understand? So you are going to have more areas to assess. That's a problem. So it is clearly state you have to have clear background theory knowledge. It's not just do this most recent papers, topic wise revision, I'm okay. No, it's not. You have to have clear knowledge. When you become a doctor, you have to have that clear knowledge about your basic science, about your basic things. Do you understand what I'm telling? So now you can understand. Today my lecture's purpose is to brainstorm you about the new format. What are the advantage? What are the disadvantage? What are the possibilities? How you have to prepare? You have to understand what's going to happen. Otherwise, you will be blank. Definitely, the first attempt people, first time doing people might face lots of difficulties to do this exam. But some people who are having good, rational thinking and rational way how to handle the acute situation, they can simply pass the exam. Because everybody might know the stuff. But now the thing is, at that time, how you are managing that situation is determining you whether you are going to pass or not. See, that's what they are assessing. Critical thinking. Critical thinking. That is the most important part. Critical thinking. When you have a unpleasant environment, how you are going to manage it? How you are going to do it? Do you understand? It is a very, very important part in your OSCE. So I clearly told you, MCQ, it's not going to change much in terms of formats. It's going to be same. So the theory class, the paper classes are going to be same. We don't need to do much, but for the Viva, we need to completely restructure. So now I'm preparing the stuff now, because even though it's going to be in May or June, we need more time to prepare all the stuff. We have to record every stuff. We have to provide so much of information for you. We have to do lots of live classes. We have to do lots of practical sessions, so practice sessions. You need to answer. You have to get practice. So this is going to be a proper practice. So if you come if you get a chance, come to UK. There is a village called Manchester, like a Plab village in Manchester. Because people around the world, they come. So one institute called Swami, he has a village. Even he brought lots of houses and he has a village. People are traveling all over the world and they rent the house and stay there, do practice. So most of the things you need to perform in mannequin. So we are importing lots of mannequin because you need to perform it in the mannequin. Do you understand? So that is how they are conducting the PLAB. So it is need in-person practice. You have to change your attitude. You need to start talking. You need to start practicing. You need to do performance. Then only you can pass the exam. Just coming to the class and watching, seeing, or just watch the recording only, it's not going to work. Yes, the recorded material Relevant study material will help you to prepare yourself, but your pass rate is depend on how you are performing. You need more practice. So how we are going to do it? We may have to do mock exams. We may have to do lots of in-person practice, maybe online practice. We have to make so many model OSCE stations and let you to do. Because the other thing, now just imagine 10 minutes into 20 stations, so 18 stations. So 180 minutes you need to continuously talk, which means 3 hours you need to talk. Do you think it's easy? Just come and sit in my seat and you will understand how difficult to teach for 4 hours. At the end, at 3 hours, only the gas only will come. Because you are continuously going to present. For 3 hours, you are going to talk. So you need practice for it. Second thing, like if you are not doing Obs-Gynae well today, you might have 2 or 3 days time to prepare medicine. So you have time to recover from that stress to do your medicine. You might be good in medicine, but you didn't well Obs-Gynae, but still you have time to breathe before you do medicine. But here, no. If you are out in one station, next moment you are going to the next station, which is medicine, your favorite subject. So you are still in that stress. I didn't do well. You are out of mind, but you have to perform in the next station. These are the practical things. You have to understand that. You didn't perform well, but you have to recover immediately to perform next station. Otherwise, you are failing the exam. So I don't know whether you got this idea from the other meetings, but I believe I'm giving very important information. Am I right? Test me.
So I have a small question.
Yes.
So will there be a minimum mark that has to be obtained in one station? Like suppose
No.
someone gets 0 for 2, 3 stations and still
No.
manages
Actually, that is what Lucina, Justin, we don't know because they haven't clearly mentioned about it. But existing system, no. They like existing international system. There is nothing like that. Even if you are out in one station, that won't affect the other station. But we don't know what is the SLMC's plan because they haven't clearly mentioned about it. About the marking scheme in OSCE in that article, isn't it? So we are not sure, but in international exams, no, it's not like that. But in a particular station, if you fail certain things, they might fail you. Like say, for example, as I mentioned, patient safety. But still, you have a tick box. You have to mark it. So you have to answer those tick box. So it is going to be challenging. I agree. So this is very new format. So very careful. So now, if you have any question about the OSCE format and stuff, then we can move forward like how the transition is going to happen. Any questions? Right. So as they mentioned, they are introducing this one from 1st of January 2025. So they gave the option. So students who are going to sit the exam first time, especially the part 1, they have to sit for the new format. Okay. So that is what they clearly mentioned. So if you are doing first time, you have to sit for the new format. But if you have done the theory in old format, or if you are in the process halfway through, then you can continue your old format in 2025. There will be 2 exams in 2025. So you need to complete those exams within 2025. That is what they mentioned clearly. So say for example, if you fail one subject in Viva, then you can do your old format in 2025 and finish it off. But if you couldn't do with the old format in 2025, you have to do the exam in new format in 2026. So in 2025, we will have two format of exams. One is old format and second one is new format, but marks and rank will be together. But basically, marks and rank will be together, but the exam format will change. How many times we can do OSCE? They haven't mentioned clearly, but you don't need to repeat the theory exam if you fail OSCE. So because these two components are different, part 1 and part 2. So part 1, if you complete the part 1, it's done. There is nothing correlation between the part 1 and part 2, but the correlation is you have to complete, you must complete part 1 to sit part 2. The eligibility is complete part 1 to sit part 2. Yeah. So, but if you fail the OSCE, then you have to repeat. So then just imagine now you need to study all the subject every OSCE. So it is going to be painful. I'm telling you. It is going to be painful. So don't skip any subjects. Study parallelly all the subjects. Okay. So here the traditional way of preparation, traditional way of teaching, it's not going to help you. So we will help you. I will help you. Everyone will help you, but you also have to do the hard work to pass the exam. That is what I can tell you. Otherwise, you will fail the exam. I have completed your theory class. Should I join your Viva class? Of course. Whoever did the exam so far, please go ahead with the all format Viva course. Do your exam as previous. Complete your Viva by next year. Please do it. Okay. So you don't need to worry. And also I want to inform you, if some students already joined to my Viva course, the old format Viva course, when I am introducing this new OSCE classes, the amount you paid for this old format will be utilized for the new format. So that is what I'm thinking. So you don't need to pay again, because some students, they thought like if we join to the Viva, then they don't need to pay again. So it is not, for me, it is not right to ask you to pay full amount or like pay again. So I will give the access for the students who joined to the Viva earlier for the new format. Okay. So that is what I'm thinking. We haven't structured the course. We haven't, actually I haven't. So I have to do hard work. So because I have another 6-7 months to prepare all the content. So I'm working on it, because as I mentioned, it is quite risky for as a teacher, because we need to cover lots of area beyond the routine classes. Even like as I mentioned, like hyperemesis, ectopy, recurrent pregnancy, like some more topics might come. So we need to cover those topics as well. But for the first 2 batches, probably they will give the routine or common cases. But with the time, there could be some odd topic, like as obs-gynae 3 station means 2 station might be common, 1 might be a rare topic. Even surgery will be the same. Pediatric will be the same. Medicine will be the same. Because now you don't have part C, right? So part C component is going to incorporate with these OSCEs. So even ectopic, there will be a part of management, your part C. How are you going to resuscitate this patient? How are you going to manage this patient? That is your part C. Previously called part C now. So we don't need to join the Viva. That's what I'm telling. You can join to the Viva class. It is not a problem, because again, going to be same, but the format will be changed. Even by you are paying the Viva, you are not going to lose anything, because that money I will give the compensation for your new courses. So you don't need to worry much. If you join, That's not a problem. Please join and utilize this time. I would say, like, get your time early, study, because like even in my Viva classes, my classes won't be an issue because Obsen Gynae, if you attend to my all classes, it's not easy, it's not difficult to pass the exam because this is the format I taught you in a different way, because that's the reason I had a good pass rate, because I never give a format. I'm always telling, I'm not going to teach you as a case, as a case, as a case. Because I just want you to make in a rational way of thinking how to approach the patient, critical answering. These are the things I always telling you, no? Even when you are coming to the case discussion, you might see like even I'm correcting everything, saying good morning, good afternoon, how to introduce, everything I'm correcting, right? That is your communication, isn't it? So I have been trained like that. So I don't think it's going to be a big change in obs and gynae. I'm not aware about the other subjects. How did you prepare? But now you have an idea. You have to prepare yourself according to the new format. So if we are doing OSCE next May, we don't need to watch previous. So that's what I'm telling. Please watch the videos because it's going to be same. And even if you buy this course, that money, I will give the compensation. You don't need to worry. Whatever the amount you pay, yes, I will give you access, because that is not right. So I will not do that. So yeah, the amount will be utilized for your new courses. When I'm introducing the new course, I will give the compensation. Don't worry. Okay. So about watching those classes uh, as a student who are doing exam in 2025 wouldn't be beneficial to, yeah, of course, that's what I'm telling. Please, it's beneficial. Please join, because as I mentioned, the communication with colleague, communication with patient, information gathering, all I'm teaching in the Viva. But OSCE, the special preparation, I will give you close to the not the close to the exam, when we are launching the course close to the next batch. All right, okay. So these are the common thing, you can even read about it, because I don't want to read the guideline and or the PDF and tell you, because that everyone can do. But I just want to tell the important points behind it. So I think I have highlighted everything. Okay. So there will be 2 exams. They will assess the quality of exams. And yeah, this is, you all know, like 7 subjects, all 7 subjects will be included for the part 1 as well as part 2. Right, and the examiner panel consists of basically 7 subjects committee. That committee will decide the questions, right? So this is a common exam format. Like, so the committee will give the exam, the possible exams. On the exam day morning, there is a meeting. I forgot that name. Oh my god, shit. There is a special meeting. So the chief examiner will choose the exam questions from the pool, which has been suggested by the committee. Like say, Comet might give like 10 questions, Obs and team might give 10 questions. Then the chief examiner, who is responsible for that particular exam that year, will choose the questions from that pool, which has been suggested by the committee. Then that will be given to you. That is how it's happening. So like, even if somebody who is in the exam panel who gave the question can't give the question to you, because even that panel member does not know which question is going to come in your SK. So it is a good way actually. Well, he gave some questions. The panel members gave some questions, but they don't know whether their question will appear in the exam, because the chief examiner only know which question is going to appear, and they will choose the question on the exam day in the morning. That's it. So no one knows. It's quite difficult to do like these kind of things. Okay. Yeah, these are the things you can see the subjects. What are the, how many questions? Paper 1, medicine and pediatric, 20 MCQ, 25 MCQ. So it's the same thing, right? So like earlier also you had 25 MCQ, 25 SBA. Same. Now they combine together, more time. That's it. Earlier it's just 2 papers. Now it's 1 paper. That's it. But they combine it. Okay. So 3 papers, you have to complete all 3 papers. So the proportion of questions from each subject, it's not changed. So there is no changes in the theory course. So theory paper classes are going to be same. There is no changes, but OSCE is completely changed. You have to study hard, okay? And yeah, subject committee will give the questions, then equal marks for each question. So again and again, I'm telling, so you can't say this subject is priority. I have to study medicine earlier. I have to study pediatric earlier. I have to study general earlier. I have to study what is the next step? Surgery earlier. No, you can't tell like that. Okay, you can't tell like that. You need to basically you need to prepare every subject equally. Okay, pass marks is 50. As I mentioned earlier, I have already talked about this pass marks. You need to get more than 50. If you get less than 50, 25, you fail the exam. If in between, then you can do that particular paper only. Okay, but any of the paper, if you get less than 25, you need to repeat all three papers. Very careful. Okay, yeah, they clearly mentioned day 1, day 2, day 3. What is the timeline? When is the true false? When is the SBA? Perfect, right? And ERPM structured 20 state circuits, 18 circuits with the questions, 2 circuits for the rest station. So luckily, if you get the free stations after the flopped station, then you get some time to breathe out, breathe in. But if not, you will be in trouble. Okay. So altogether, you are going to be inside the hole for 200 minutes, more than 3 hours. You just went in and you are rotating. It's like it's a battle. You will feel it because I went through this exam several times. Part 1, part 2, MRCOG part 3. Oh my God. So it is a different feeling. It's not just a 20 minutes and come out. No, it's 200 minutes. Just imagine. You are going to be with the examiners for 200 minutes. Okay. So you have to prepare your mind. Okay. So these are the numbers. So medicine, there will be 4 stations, pediatric 3 stations, surgery 3 station, obstetrics 3 station, psychiatry 1 station, community medicine 2 station, forensic medicine 2 station, and rest station 2, altogether 20 stations. Okay, right. So equal marks. So you can't choose anything. You need to study everything. Pass marks around 50% for all stations, so even part 2. So altogether, you have to get 50% of marks to pass. If you fail, you need to repeat all the subject in next attempt. Okay. So few words about the Maura phase 2. We are talking about the Maura phase 2 for a long time, but I'm waiting for we have few things about with our developers because we so it is one of my mistake because I have given this Maura to upgrade with other companies and yeah, they wanted to incorporate lots of features, so that's the reason. But we are almost done now. We are doing the mobile app check, so you will get the mobile app sooner by this year end. Okay, and very easy. We are using hi-fi, like little bit more techniques, because it is not going to be an update. It is going to be a shift of platform, because the which Maura education which we are using right now will not be used later. Once the phase 2 comes, you need to move to another app. There will be 2 apps. One is going to be a Maura Edu, and another one is going to be a Maura. Maura is a ed edtech providers. So that is what they are doing. So what do you mean by edtech providers? So the edtech providers means that app is available for the students as well as the open public. Even as a student, if you want to do a class there, yes, you can do. So you will have your backend, you will have your own institute. So it is going to be like a Coursera or Udemy, but Udemy, Coursera, you are providing only the courses only. But here they are letting you to create your own institute. You can have your lecturers, you can have your own lectures. So you might be good in, maybe you might be good in obs and gynae, you can teach. It's not going to stop you. You might be good in medicine, you can teach. Or you might be good in script writing, you can teach. You might be good in OET, you can teach of OET, right? So it is going to be a common platform at tech providers. That is the Maura. That is a different one. Maura Edu is a different one. There will be two app, but both app, the courses will be like my courses will be in Maura Education, and the Maura Ed will be launched in March. So that is going to give the job opportunity for each and everyone. Even if you are good in physics, chemistry, biology, whatever the subjects, you can bring your students in, you can use this platform, you can test these features. So that is what their plan. So they will launch it and they will let you know. So I will let you know when they launch it. But in terms of obs and gynae classes, so I will, like I have recorded the new videos for the theory. So I'm waiting to upload till my mobile apps comes. So once the mobile apps available, once they inform me, I will upload everything to the platform and let you know. Right, so you will get a good convenient application. So basically more education, I have had it now. It is in a different like dimension, so you will see it. So I'm also excited to see. I'm really fed up with those people because they are taking lots of time, but still they convince me because of they said it's lots of features and blah blah things. So basically accessibility, self-paced learning, educational planning, variety of courses, because as I mentioned, like, yeah, so it's open for everyone, global affiliations. Yeah, so like as a Maura Education, we have affiliated with CPD, APHM, Trinity College UK. Now we have affiliated with East of England training training, and it is registered in UK. So like it's kind of moving towards the international platform and interactive learning, paperless educations, because you will understand, like we have the options for the notes taking, ask questions, like lots of features. So updated content. So I'm writing the guidelines as well, like guideline summaries as well as the guidelines. So we have the inbuilt library. So all these guidelines and guideline summaries will be uploaded to the library. So when you read the particular topics, those relevant guidelines and summaries will be popped up in your page. So you can read it if you want. Then you can take the notes as well. All right. So network opportunity. So as I mentioned, so it is open for everyone. So you get the collaboration and networking with different kind of people out of the box, not with the medical courses, and cost effective, of course, because you don't need to have your own platform. So if you want to write an online platform like Maura, at least you need 50 million. You can't do it. Yeah, but you can do with free of charge. So that is how it's going to work. So yeah, as I mentioned, Maura Library, so Distinguish itself is comprehensive online library with range of resources. So I will give the access for the guideline summaries only for the students who join to my classes. But the guidelines will be available for anyone. So whoever in the Maura, they can, Maura Education or Maura, they can have a look, they can watch the video, they can read the guideline, but guideline summaries are accessible. So because there are two type of books in the library, one is the premium books, which is available only relevant to the courses which has been uploaded by the particular teacher, and some materials which like the free guidelines and all I will upload, so which is available for everyone. You don't need to have any confusion which guideline is right, which guideline is wrong, because the right guidelines only will be uploaded to the library. So whenever you want, you can go to my library, just search the particular guideline and you can read it. Okay, so we are working back end a lot, like lots of people are working with me to write these guidelines. Your seniors, your colleagues, they are doing part-time job with me to write the guidelines, short notes, right, and guideline summaries and journal articles, even TOGs and other articles. I'm writing the summary. So you will get, yeah, because the SLMC is going to the next level, so we have to upgrade it. So I'm not going to be like a tuition class teacher, right? So I have to upgrade it. So that is the reason I gave this platform to some other people to develop in a different way. So they will do the business, but I will do my classes on it. Okay, so you also can get the opportunity. Yes, be prepared and do it. You might be a good teacher than me, sometime you might have a good future. I don't bother, because in my policy, I never tell I'm the best teacher, because some students might not understand my way of teaching. So in that case, students has rights. They are deserved to study from a teacher who do well. This is my policy. Teaching, it's not business. Teaching is a service. That is my. But I'm investing my time. I'm spending my time. You're paying. Yes, thank you. But that doesn't mean I will make money by doing teaching. So I'm doing for my that's all. That's it. So if you are a good teacher, if a student wanted to go to study a good teacher, yes, you are welcome. You can go. But if you think you feel better with me, you are comfortable with my teaching, yes, come. I will do my hard work to give adequate information and knowledge to you, to make you a safe doctor. That is my policy. So different people might have different policies. This is my policy. Okay. Right. So Maura Circle, this is another way. Actually, we are having what do you call this? Social media features like Instagram, so you can share your thoughts and your achievements and your completions and all. So, and your friends can share, comment, and things like that, because you don't need to go outside. You will still in the educational platform and educational background and do certain things. And yeah, basically Maura shops. So we incorporated the shops inside. So we are letting the Jia Book Center, Sarasavi. Even if you have a book, yes, you can open your shop. And we collaborated with the delivery partners. So, like, say for example, like if you want to buy my book, you don't need to go anywhere. You can just order in Maura app itself. We have the inbuilt shop app itself. The book will reach to your home. That's it. So we are making available everything at one point. So Maura shop is available. So here the Maura shop is open for everyone. Whoever want, they can open their shop, they can sell, can do their business. And Maura Messenger. So we are going to have the inbuilt messenger. So you don't need to share your number with your teacher, with your colleague, anyone, because that is your privacy. You don't need to. But you can communicate with anyone through Maura. So we are going to have our own messenger as Facebook. Yes. So so by keeping your data privacy, still you have the option to communicate. And asked out feature. So whenever you read, then and there, you can communicate with the teacher through the asked out button. So through our messenger, you don't need to share your number. You just text them. So the teacher will get the notification or message, relevant topics, then teacher will answer to your questions. So you don't need to type each and everything whenever you do the ask the doubt. So if you are doing a particular question, there will be a button for ask down. Just ask doubt button. Then teacher will get a message like quoting that question. This question is this student is asking a doubt about this question. So you don't need to spend hell, because I'm seeing lots of students are taking a photo, sending the question, sir, in this third question, what could be the reason? So you are spending unnecessary time. So you don't need to. You just ask a doubt. So then teacher will get a notification along with that particular paragraph or particular question. So then teacher will communicate through the messenger. Do you understand? So we have the messenger. We have honored that you have chosen More Education to support your teaching. Your trust means a lot to us. We are excited to collaborate with you all in providing enhancing learning experience. You all are welcome. You all are invited to be as a students, be as a teacher, be as a shop owner, and be as a member of Maura. Any questions? You will be excited once we launch. Then you will realize why we took this much of time. Because it's massive. I'm telling you, you will not find another platform like Maura once we launch in global. Even you can see the Udemy, you can see the Coursera. Those are the famous educational platforms, right? You can see those kind of platform, but they will not have these features. You will be amazed. Sirs, the students who sat for the exam this time, we have to join the Viva class, which, yes, of course, you have to. Yes, you have to. I'll send the message again to clarify you. Please join to the existing class. Even if I launch the new courses, you will be get the access to the new courses. Depend on your money will not be wasted, so you don't need to worry. Please utilize this time and study. Okay. Any questions? Any questions? Okay, if you don't have questions, we'll conclude. I'll share this video after editing. So please share with your juniors and make them aware, because I believe my session might be a effective one and might give some idea about the OSCE and how they are going to assess and how you have to prepare. Because I'm sure no point of sharing the like PDF, what is the PDF and stuff, right? So this is the way how to critically like analyze a format. Like I think I have done a critical analysis about the new format. So now you might have a clear idea about it. So you have to understand which is right, which is wrong. You all are adult. Yeah, going to be a doctor. Critical thinking, rational way of thinking. It's very important. Any questions? All right. So what is
Excuse me,
the
doctor.
yes?
Approximately it.
What is the guide for coming Viva? Join to the existing Viva class. I'm going to start. Please do your practicals. Do as routine. That's it. You told it's all without sugar coating. Yeah, of course. Thank you. Yeah. Sorry. What was your question?
Yeah, approximately in which month you are planning to do the OSCE classes for the 2025 batch?
Probably next March, right? I need another 4 months to prepare all this material. It's not easy. And your next theory exam will be in May, right?
Yeah.
So after that only OSCE. So I thought to like now I'm preparing the material. I have to record. So we need to do lots of work behind it. So for you it's easy. For us it's quite risky task. You don't understand. Even to prepare a set of new recorded video, it took like 1 year, good 1 year. So it's not easy. And so many people, and I have spent millions of money. You don't understand. But yeah, but it is my duty. I will do because I'm doing all the things in a standard manner, the international standard. You can see, like, you have to see in a like overall view, like how we are developing the platform, how we are providing, because I have to be genuine. That's it. Whatever the money you give, I have to be genuine for it. So probably I'll try to do it by March or April. So by that time it will be ready. So then we need more time for the preparation for the next batch because it's a first time. So we need to do more live classes, more preparation, more practice. So because all have to come to the track, right? So it's take time. So I'm planning to do more time. So it's not the matter of hours. So earlier 4 hours class 1400, 1500. No, it's not that matter of that. So this is a course for you to prepare. So it's not depend on the hours, because even when you join to my Viva class, you might see how many like case discussion I'm doing. It's not counted in hour. It's not counted in hour. So it is the preparation. That's it. I will help you to prepare and pass the exam. That's it. Okay. So I'll help you. Don't worry. So we have to watch both Viva class and OSCE, right? Now, better to watch the Viva once we launch the OSCE. Then, if you are going to do the OSCE, then we will move to the OSCE class only. Now, better to watch the Viva class because Basically, the concept is going to be same, but with some kind of modification and makeup, right? So we get the Sinhala or Tamil patients. I think it's going to be English. I'm not sure. I can't give you false information. Probably going to be English, but I'm not sure. Don't take this one as serious, but I'm not sure because they haven't mentioned. But most probably will be in English. I'm not sure. Okay, thank you so much. I'll share the video. Please share with your juniors. That is the only help I'm expecting from you. Please. Because they should understand. Because they are not in the mood to understand the seriousness of these exams. Okay. Please do that help. Okay. Oh, it's an eye opener. Oh, thank you so much. No problem. Okay. If I give a good information, I'm happy. Thank you. All right. Thank you so much. Thanks for joining the session. I'll share the video. All right. Have a nice day.
Thank you, Doctor.
No problem.